Have you ever experienced numbness, tingling, or burning sensations in your hands or feet like ants crawling under your skin but only received the familiar answer? It could be age, diabetes, or neurodegeneration. But there's a less discussed truth of silent, common, and often overlooked cause, even in routine medical tests. And this could be damaging your nerves day by day, even if you eat a healthy diet and take your medication regularly. Even more noteworthy is that many people have seen significant improvement in numbness, pain, and loss of sensation after recognizing and addressing this factor without increasing medication or undergoing invasive procedures. In today's video, we'll uncover the little-known causes of peripheral neuropathy, why many doctors miss it, and most importantly, what you can do to protect and restore your nervous system from the root. If you or a loved one is experiencing symptoms such as numbness in the hands and feet, muscle weakness, loss of balance, or persistent nerve pain, don't miss this video. The information you're about to hear could completely change how you view this disease. Peripheral neuropathy rarely appears suddenly. In most cases, it develops silently over months, even years, before the patient actually realizes something is wrong. It might start with a slight numbness in the toes, sometimes a fleeting tingling sensation in the hands, or an unusually cold sensation even when the ambient temperature is perfectly normal. These signs are often overlooked because they do cause intense pain and are easily mistaken for ordinary fatigue or signs of aging. This ambiguity causes many people to delay seeking medical help. By the time symptoms become more pronounced, such as persistent burning pain, loss of sensation, muscle weakness, or difficulty maintaining balance, nerve damage has already been silently accumulating over a long period. In clinical practice, doctors often focus on the most common causes, such as diabetes, spinal cord injury, or genetic factors. If basic blood tests and imaging don't show clear abnormalities, patients are often given a generic diagnosis and prescribed nerve pain medication, while the true root cause remains unclear. One of the least noticed but extremely common factors is a near deficiency, vitamin B deficiency. It's not a severe deficiency that would cause test results to exceed warning levels, but rather that vitamin levels are just enough to maintain basic vital functions, but not enough to optimally nourish and protect the nervous system. Vitamins B1, B6, and B12 play crucial roles in maintaining the myelin sheath, the protective layer of nerve fibers, as well as in signal transmission and micro-repair. When the body lacks these nutrients for a long time, nerves gradually become sensitive, easily damaged, and send abnormal pain signals. Modern lifestyles contribute significantly to this situation. Long-term use of stomach medications, diabetes medications, or antacids can reduce the body's ability to absorb B vitamins. A diet rich in refined foods and low in whole foods, along with prolonged stress and alcohol consumption, causes the nervous system to enter a state of nutritional starvation without the patient even realizing it. One of the most common and easily treatable causes of peripheral neuropathy is a vitamin B1 deficiency. Vitamin B1, also known as phthalate, is essential for hundreds of different functions in your body, but one of its main functions is to help the tiny nerve endings in your fingers, toes, and other areas metabolize glucose so that the nerves can function optimally. And if that doesn't happen, then peripheral neuropathy will occur. When your B1 levels are chronically low, these tiny nerve endings will lack energy, and then you will experience numbness, burning, loss of sensation, loss of balance, a feeling like there's something in your shoe even though there's nothing in it. And eventually, it will lead to permanent nerve damage if you don't detect and treat it. Therefore, it's important to understand that your body doesn't actually store much vitamin B1. Usually, there's only enough for about 10 days, totaling 25 to 30 milligrams. If you don't eat foods rich in vitamin B1 for 5, 10, 15, or 20 days, you may become deficient in vitamin B1 and start experiencing neurological problems that doctors can't identify. It's very important to know this, and I'll be discussing all of that in this video. First, let's talk about medications that can block vitamin B1 absorption. You might think these are strange, rare medications, but in reality, they are some of the most common drugs people use in modern society. Diuretics, especially loop diuretics like Phylmedy or Lasix, and Bumetanide diuretics, can severely limit the body's ability to absorb and retain vitamin B1. They can also increase the tendency to excrete vitamin B1 prematurely when you still need it. Another type of diuretic that has a similar effect, not as bad as loop diuretics, is thyroid diuretics. The most common RHCT or HCT, you will excrete vitamin B1 through urine even when you are deficient or need it. Metformin can actually cause you to urinate prematurely, eliminating vitamin B1 from your body, even though your body needs it. One very common medication that can reduce the body's ability to absorb vitamin B1 is proton pump inhibitors such as Nexium, Prevacid Piloc, and others. They greatly reduce stomach acid, and that alters the body's ability to absorb the vitamin from food. Next is alcohol. Whenever you drink a lot of alcohol, it reduces the amount of available vitamin B1 that your body can access and use. Alcohol interferes with vitamin B1 absorption and also increases the amount of vitamin B1 lost through urine. Chronic alcoholism is a typical cause of neuropathy. It can be a problem with vitamin B12, vitamin B6, or vitamin B1. Because you need enough magnesium to metabolize and use vitamin B1 effectively. Now, two less important things, but you should be aware of them in case you eat too much of either of these. Raw fish and seafood actually contain an enzyme called thaminase, which breaks down thymine. This doesn't mean that if you eat raw sushi, sashimi, or oysters, you're deficient in vitamin B1. You're on a diet low in vitamin B1, and then you crave sashimi and eat it every day. The thiamine acid in raw fish can lead to a vitamin B1 deficiency. And another cause is anything high in sulfites, such as wine, dried fruit, prunes, raisins, and some processed meats also contain sulfites. And again, if you only drink one glass of wine, that won't cause you to be deficient in vitamin B1. But if you drink a bottle of high sulfate wine every night and your diet is relatively low in vitamin B1, then you may be deficient in vitamin B1. Finally, a note for anyone with ulcerative colitis, Crohn's disease, or irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, chronic diarrhea, and chronic malabsorption can lead to either true or latent vitamin B1 deficiency, so keep that in mind if you are diagnosed with one of these conditions. So what are the typical symptoms of vitamin B1 deficiency leading to neuropathy? It's a feeling of numbness and burning in the feet. Toes feel numb, or there's a tingling or prickling sensation in the toes or fingers, and this worsens at bedtime. Feeling unsteady when walking on carpets or when walking in the yard, garden, or lawn. And if you feel unsteady and lose your balance a lot, it could be neuropathy. Along with neuropathy, due to vitamin B1 deficiency, you will also experience mild to moderate chronic fatigue. The best source of vitamin B1 is basically any type of pork. For example, pork ribs, any type of pork you plan to grill. That's the best way to cook pork to retain the highest possible vitamin B1 content. If you boil pork, the moist heat will destroy a lot of vitamin B1. If you cook pork at a very high temperature, or if you cook bacon at a low and slow temperature, it will still be a great source of vitamin B1. In addition, pork, liver, salmon, and tuna are also pretty good sources of vitamin B1. We've actually seen vitamin B1 deficiency in people who eat a meat-based diet. They only eat beef or ruminant meats, such as beef, lamb, goat, and they never eat pork. This isn't very common. It's rare, but we've seen it in about 4 or 5 patients over the years. Don't do that. Just start eating foods rich in vitamin B1 in your diet. I prefer you to get your vitamin B1 from food rather than from supplements. Another, often overlooked cause of peripheral neuropathy is blood sugar fluctuations, even in people who haven't been diagnosed with diabetes. When blood sugar spikes suddenly after a meal and then drops rapidly, the small blood vessels that nourish the nerves are put under great pressure. Because the patient hasn't reached the threshold for a diabetes diagnosis. This connection often goes unnoticed and continues to cause silent damage. Alongside this is low-grade chronic inflammation in the body. This isn't the kind of inflammation that causes fever or acute pain, but rather a long-lasting insidious inflammation stemming from a diet high in ultra-processed foods, fatty acid imbalances, gut microbiome disruption, and deficiencies in natural anti-inflammatory substances. When the body is constantly in a state of inflammation, nerves become more sensitive than normal and can signal pain even without obvious mechanical damage. Furthermore, environmental factors also play a significant role. Heavy metals and neurotoxins in modern living environments can gradually accumulate in the body without causing immediate symptoms. Over the years, they directly affect nerve conduction function. Because of their slow progression and difficulty in detection, This cause is often only considered when the disease is already in an advanced stage. Some medications used long-term can also contribute to peripheral nerve damage. It's worth noting that symptoms often appear gradually, making it difficult for patients to associate them with the medication they are taking. When numbness and pain appear, many people assume it's a natural progression of an underlying condition or age, rather than a potential side effect. The body always sends warning signals before damage becomes serious. Increasing numbness or tingling at night, loss of sensation between hot and cold, feeling like you're wearing socks even when barefoot, or weakness that makes you more prone to falls than usual are all signs that shouldn't be ignored. Regardless of the specific cause, the nervous system always needs protection through proper nutrition, stable blood sugar, a low inflammation living environment, quality sleep, and regular exercise. Many people have reported significant improvements in sensation and mobility only after adjusting their lifestyle and correctly identifying the harmful factors silently affecting their bodies. Peripheral neuropathy isn't always an irreversible sentence. In many cases, what makes the condition serious isn't the initial extent of damage, but the fact that the underlying cause has been overlooked for too long. When nerves suffer in silence, each passing day contributes to weakening the body's natural ability to heal. It's important to remember that numbness, tingling, or burning sensations are not normal signs of aging. They are the body's way of crying out for help. When you start listening to these signals and understanding what's happening inside, you're halfway to protecting your nervous system. If you or a loved one is experiencing the symptoms mentioned in this video, don't just endure them or rely solely on painkillers. Take the initiative to learn more, have open discussions with your doctor, and start adjusting lifestyle factors that may be silently damaging your nerves every day. On this channel, we share easy-to-understand science-based health knowledge that focuses on the root causes, helping you make better choices for your body. If you found this video helpful, please hit like to spread the word to more people. And don't forget to subscribe to the channel, because every week we bring you new content to help you protect your nervous system, improve your quality of life, and proactively manage your long-term health. Remember, your body has a much stronger ability to heal itself than you think, given the right conditions. Thank you for watching until the end of the video, and see you in the next content on the channel.